My name is Dana Carlson. My husband is a firefighter for a department just north of us, outside of Seattle, but we live in a suburb of Portland, Oregon. I have 3 kids, and I'm a stay-at-home mom slash firewife. So I'm on the young side for this topic, but not shockingly so, actually. My mom got breast cancer when she was 43, and it was a huge shock. She had a cousin who was actually going through it at the same time, but other than that, we didn't know of a family history with cancer. But her breast cancer was very invasive. It was BRCA positive and HERS positive, so estrogen-based cancers. And it got us to kind of look into our family history because we were clueless. And her mom did not have cancer, but we discovered that every other woman on my maternal side, up to my great-great-great-grandmother, had breast cancer, all of whom had it in their 40s, all of whom, beside my mom and her cousin, passed away from it. My great-great-great-grandmother had breast cancer before they knew what it was, and they said she died from a lump in her armpit. I am going to be having a prophylactic double mastectomy in February. It is not a decision that I took lightly, and I went in, I saw a genetic counselor, I have a breast specialist that I see, and I was presented with a lot of options. I was either going to start having mammograms and MRIs annually, starting at 32, or I was going to try to do the prophylactic mastectomy, or I through my own research, discovered thermography, which is heat-based detection of cancers with a naturopath. And I, after a lot of praying and a lot of soul searching and a lot of crying on my husband's shoulder, came to the decision that the prophylactic mastectomy is the right route for me personally.
My name is Tiffany Swartz, and I am a firefighter wife to a wildland firefighter. I have a 7-month-old little boy who is crazy. That's why I have no makeup on right now, because of the head from yesterday.
Oh, that's right.
But yeah, when it comes to breast cancer awareness, it's something that's, with going through the process of getting tested to see if I carry the gene and having it run so prevalently in my family, it's something that I feel so strongly about to get the word out. Getting tested early is a big deal in my family for the fact that the cancer does come pretty early. So, I've been getting mammograms since I was 15 years old.
There are particular blood tests that are done. Is that right? Are they blood tests?
Yeah, it is so easy. If you've ever been pregnant, that first blood test they give you when you find out you're pregnant, they make you go, and there's 10 vials, it feels like.
Yeah.
This blood test, I was expecting it to be kind of intrusive because of what it's testing for. It was the easiest thing I've ever seen. It looks like this huge tube they pull out, but it's only a protective one, and they pull out this little tiny one. And I mean, it looks like just not even an ounce of blood. I mean, it's so small.
Wow.
And it's so non-intrusive and invasive that it was comforting for the fact that it makes you really see how far technology has gone, that they could use so little but gain so much information from it. Instead of just doing little chemical treatments, do a full double mastectomy so I don't have to worry about dealing with it in the future. And he's been nothing, for a boob guy, he's been nothing but supportive.
Yeah, so here's what I can't believe.
Growing up with my dad, who had to watch his mother go for years through these treatments, and this is before they had the technology that they do now, and it's really affected every member of my family. I mean, even to this day, about different things. Watching my aunt every year have to go get lumps removed because she does hold such an identity to her breasts. That's her womanhood. She's not wanting to give them up. I just came to 10 years ago, 5 years ago, I probably wouldn't have had this thought. after having a child and getting married, I realized that the best gift is, as much as I love my chest, getting, opting out and going through a surgery where I'd rather have my husband hold my hand and recover than having my family hold my hand and hope I make it. And, I want to have more children in the future, and I love the thought of breastfeeding, but if I have to opt out of maybe possibly breastfeeding my future children, to say I'm doing everything in my power to make sure I can be here as long as I can unless God, sees another plan, that's the best gift I can give my family. And I hear so many women say that they're too scared to get the results. They're just scared of the answer, so they don't want to ask the question. And I am totally terrified of the answer. My whole family jokes because I'm like, if it comes back negative, we're throwing a party. I've lived so many years with the fear of what's going to happen. But, as a parent, I've never heard any parents say that they wouldn't, take a bullet for their child or, put their life, in front of their child's, like, to save them. To me, this is what I'm doing for my kids. And if I have a little girl, I want to know if I carry the gene because I want to know if I pass it on.
So you, if I remember right, you have high family risk, but you haven't been tested yet.
I haven't. I've had lots of problems my own self, starting at age 18, where I had a grapefruit-sized lump removed. Thank God it was benign. But back in the day, which, was 1977, they just put you to sleep. You didn't know. And so 18 years old, I went to go get birth control pills, and, they found this lump in my breast, and they're like, he brings the surgeon in at that appointment, and they're all like, oh, if you have breast cancer, you're really young for that. That would make the medical books. And I'm thinking to myself, are you joking? Are you kidding me? Obviously, men doctors. So then they used to just put you to sleep. And, when I woke up, I'm like, look at my chest to see, because you didn't know what they were going to do. Yeah. So at least things have advanced from that. But every year I have a mammogram. Almost all the time it's a bad one. I have to go back for a cone compression and ultrasound. I've had stereotactic biopsies. But my mom has had breast cancer twice. She had the non-estrogen one, and then she was put on tamoxifen against my advice, and then got the estrogen receptor one. And her two sisters. And then last February, my sister, who's 11 months younger than me, went in, and she was diagnosed with breast cancer too. So you go in and you have a mammogram. It's bad. You go back and you usually have what they call a cone compression. They look at the spot more in depth, or you have an ultrasound, which really the ultimate thing would be to have an MRI. It's much more accurate, but your insurance company won't pay for that.
Okay.
So, and who's going to cough up $4,000 or $5,000 for an MRI? I don't have that. So then you usually, if that's still not good, then you have no MRI. You have a stereotactic biopsy, which I had, but now I could kick myself, because why would you do that? They take a biopsy of the spot. They put a clip inside you to mark where they're going to do surgery if you have cancer. Why don't they just take the whole spot out right away? Why are you, cha-ching, cha-ching, cha-ching? And I was so mad after I went through that whole thing, because it was really emotional. And I thought, why did I do that? Why didn't I just go in there, take the spot out, make sure you get a big enough margin, and then tell me what it is? Don't make me keep coming back and coming back and coming back. How our insurance is for me to get the bracket testing, I have to go see a genetic counselor first, and they won't pay for that. Okay. It's a requirement, but they don't cover it. So there's all these little catch-22 things, and to me, it's emotional as well as I don't know how to explain it. They put up these emotional as well as physical, basically, barriers, financial barriers, to you trying to get this decent health care that you deserve.
My husband is extremely supportive with my decision, and from the get-go told me, this is your decision to make, and I'm here to support you in whatever way I can, and has just kind of been by my side to let me, run things past him, cry on his shoulder and whatever. And he's been super supportive. I've got some family members, women in particular, who aren't as supportive, which was odd to me. And their theory was, well, you're putting the cart before the horse. But that's kind of the point, is to put the cart before the horse. I don't really want to, get to cancer and then make the decision. So, they can have their opinions, and that's fine. And, in the long run, I know I'm doing this for myself and for.
So you've had the test, you've got the results, you've decided on the surgery. It's going to be next February.
Mm-hmm.
What would you tell somebody?
For someone who knows that they're high risk, I think just to know all of your options and make an informed decision, it would be really easy for me to just say, oh yeah, sure, I'll go get mammograms and MRIs and, kind of put it aside because I'm not worried about cancer at this point. But I think to just, give yourself all the information. But my advice isn't just for high-risk women. One of the things my breast specialist told me was that 90 to 95% of breast cancers aren't hereditary. And so a lot of women don't see it coming, and they just kind of get hit with it. And so my advice is to all women, do the monthly self-exam so you have a baseline and you know that there wasn't something there last month. And if there is something there this month, don't be scared, but be informed and go in and make it known to your doctor and catch it early. If you have boobs, you have to be worried about it. So